But it should also say you're streaming on YouTube.
Yes, it is.
It is? Okay. I will just check the link, make sure that's the case.
So, Doc, are you going to talk about how people get infected, or are you going to skip that part?
Sorry, say again.
So we have participants started coming in. We have 6 people so far who has joined in.
So will they be able to hear?
Yes.
So we'll mute.
I know I'm going to send you the YouTube link. Seems to have moved. It's in WhatsApp too.
Yeah.
I don't know.
Make one soup, two butters up, chicken noodles for them. So they've got soup and noodles. Then we try green beans, the fish, potato rice. Oh yeah.
It gets to you.
Ribs and pot pot. Perfect. Okay, so
Well, I think you're going to have to go on mute.
Steam rice or egg?
which one?
Hello.
Mukul, you're going to have to go on mute.
I thought I wasn't.
All right. All right.
In the middle of a talk. Don't enter the room. Go lock the door.
Yes.
Thank you to all the attendees for joining in. We're going to wait for a few more minutes for some more to join in, and we should start by 5. And we'll make it 5 Indian time, so we'll give it another 5 minutes. But thank you for everyone who's here on time already. Vineet, we were all on mute. Can you hear us now? Am I audible? Anuj, Mukul, can you give me a thumbs up if I'm audible? Thanks, Dhruv. Thanks, Shruti. I would have loved to hear where all people are dialing in from. If maybe if you could just tell us where you're from in the chat box, that'd be interesting. And also how old you are. Thanks, Riddhi. We'll start at 17:05 precisely. So if anybody wants to grab a cup of coffee or some water or maybe go to the washroom, we start in 4 minutes. For the people who just joined in, we will be starting in 2 minutes. I see we've put up a poll. Is that true, Ishan? Is the poll live?
Yes, the poll is live now.
All right. So while we're waiting, we've got 1 more minute. The poll will run in the background. So feel free to play around with that. But while we're waiting for another minute, there's a poll up which talks about just a small evaluation of how you're feeling about your lungs. Okay, folks, it's 17:05. I think I'm going to respect the time of all the people who've joined in time, and I am going to get started. Before I do, and before we get to the main topic, I'll just give you a bit of a background about myself and Dhoond. Some of you may have heard about us, and some of you may not have. This might be the first time that you would be hearing about us. I'll just tell you who we are, what we do, why we do it, and so on. And then I'll hand over to our guests here to talk about the main topic. So about Dhoond, essentially in May this year, COVID became very, very real for some of us. The bubble that we were in suddenly burst, and a loved one did get infected, and we actually experienced firsthand the trauma that millions of patients and their families are feeling. Obviously, the healthcare professionals are doing the best that they can. They've been on the front lines, but I think at that point in time, some of us felt that it was time for the common citizen to join in the battle as well. And a few of us rallied together and decided to do just that. Our first front that we attacked was the plasma availability problem. That's something that Dhoond is now known for. And even though the jury is out on whether the therapy works or not, we do continue to persevere. Even a small chance, even a glimmer of hope is enough for the team at Dhoond to continue doing that. We do wish the authorities would partner with us to use some of our data to get to the conclusions that they have much faster, and that's something that we're doing as well. But that's an ongoing thing. As we continue to interact with patients, engage with them, we realize that the struggle doesn't end when you come out of the hospital. The recovery process is slow, is painful. The disease does take a toll on the body, the mind, and everything in between, not only on the patient, but also on the families. And a lot of us were actually clueless on what to do at that stage. And therefore, after plasma, our next priority is to aid the recovering patients through the recovery process and get them back on their feet as fast as possible. In the journey, we've met countless of like-minded people who were tired of sitting helplessly on the sidelines and join the cause. One such person I'm proud to have met is the team, or one such set of people is the team at First Doctor, who's led by a dear friend of mine, Mr. Anuj, who's a veteran in the healthcare services space. Anuj not only is the CEO of First Doctor, he's also the CEO of QI Spine. He's joined here today with his team member, Dr. Kiran, who will be taking us through the topic, which is the effect that COVID has on our lungs and what we can do to hasten the recovery and minimize the damage on our lungs. So with that, over to you, Anuj. Do educate us. We're looking forward to this.
Thank you very much, Aditya. Wonderful to be here with everybody. Like Aditya said, my name is Anuj Arenja. I'm the CEO and MD of First Doctor. We're a healthcare organization that's dedicated to chronic health diseases, which means anything to do with obesity, your heart, your lungs, your liver, your spine, any kind of chronic pain. And our whole agenda is to really help patients get better in a conservative manner, which means we try to minimize the use of surgery or drugs as far as possible by using the latest technologies and by leveraging the latest research in medical science. It's an absolute pleasure and a delight for us to partner with Dhoond. We're amazed by the selflessness and the wonderful work that the team there has been doing. We've been watching very closely, and we're huge supporters of this fabulous initiative. And really, in the way that they've come forward to help patients who've been suffering from COVID in their hour of need. Of course, COVID has taken over our lives in a manner that was inconceivable 7 months ago. And of course, there's a lot of information that people seem to know about COVID, how it's transmitted, and so on and so forth. But I think at the same time, there's been a lot of misinformation out there because there's so many of these WhatsApp messages, etc., that we all receive. And I think it's a little, there are areas around COVID that are still unclear to people. There's a lot of ambiguity about certain aspects. For example, really, what is the long-term impact that COVID has on our bodies? People tend to think that once they're negative after doing a COVID test, then they're okay. But the reality is, of course, data shows increasingly that COVID leaves some lasting damage on our organs. And of course, there are ways to minimize that impact. And that really is the theme of our talk today. How do you accelerate your recovery if you've had COVID? And how do you ensure that there is minimal long-term impact to your organs? On that note, I'd like to introduce our speaker for today, Dr. Kiran Sangani. He is the medical director at First Doctor, and he is one of India's most renowned and respected rehabilitation medicine experts. Dr. Kiran, welcome.
Thank you. Thank you, Anuj. Thank you for introducing me, and thank you for also inviting me to give this talk on COVID-19 pulmonary rehab. Thank you to the Doon team as well for inviting First Doctor to partner with them to basically create this awareness about the COVID-19 rehab as to how we can help the general population to recover in a much more faster way and in a healthier way, and obviously to prevent any type of a long-term effect of the illness on their body. So thank you very much.
Great. So, Doctor, I did say that, of course, there is a lot of information that people have about COVID in general, but it'll be helpful just to make sure that we dispel with any myths. Can you quickly summarize in brief, the COVID situation today and sort of basic facts that people should know of?
Yeah, sure. So basically, just a quick review of what is the situation today. This is the current scenario in India, whereby we are having recovery rate of almost 88%. So out of the total number of cases which have been proven to be positive, 88% have recovered, and only 10% of the population are the active cases of the infected population. So that is definitely an encouraging sign, but that should not put us onto an off guard whereby we start taking it very lightly and don't take the proper precautionary measures. So it's very important that we understand that it's a respiratory illness, whereby we're going to suffer it by inhaling the infected respiratory droplets. And that's why we need to be more careful in terms of the preventive measures that we should take. So basically, we should focus on these 3 W's. That is what we try to hear. Tell everyone, which probably everyone has read it or heard about it in all these months, but still people are not following it completely. So these 3 W's is something whereby you watch your distance, whereby we say we should maintain a certain distance between 2 individuals. And what we should use the word more commonly is physical distancing rather than the word social distancing, which we commonly use. We want people to be socially connected, but just maintain a certain physical distance so that we can prevent that infection from spreading. Because mainly it's a respiratory illness and it will spread by inhaling through your nose or through your mouth, or if it enters your eyes. Second, obviously, way to prevent it is by wearing a mask, no matter what type of mask you wear, whether it's an N95 or a surgical or a cloth mask. The whole objective is to prevent the infected droplets from falling out and infecting other person, and obviously to prevent ourselves from inhaling the infected particles. So it's going to work in both the ways, and that's why more the people wear this mask is going to actually act as a vaccine, okay, till the real vaccine comes out. So there is the latest study which came out last month. It does say that the mask really has an effect of variolation, which means it can really improve your immunity and act as a vaccine. And obviously, the third is basically we try to wash our hands regularly, maintain the hand hygiene, so that even if we are touching some infected surface, we don't really spread it into our eyes or nose or mouth when we touch our face. Okay, because practically speaking, to avoid touching our face is not going to be that much possible. But if we are wearing a mask and washing our hands regularly, we can definitely prevent that. Okay, so these are the ways to prevent it. And obviously, as Anuj asked, what are the symptoms that we can suffer from? These are the common symptoms, very basic symptoms, which can basically mimic to any other viral infection as well, whereby you can get fever, dry cough, tiredness, breathlessness, a simple body ache, just a sore throat, diarrhea. More commonly, we now see loss of taste and smell, some headache or discoloration. So very basic symptoms which people can suffer from. But with the current scenario, in a normal situation, probably people would have just ignored these symptoms, stayed at home for 2, 3 days, done some home-based therapy also, and try to wait and watch. But in this current scenario, I would not advise so. With any of these symptoms, if you experience, it's important that you take some medical attention, seek your doctor's advice, and depending on his advice, you can take the next step. At the same time, there are many people who would be completely asymptomatic also, whereby they would not have any symptoms even if they are tested positive. But that's a different scenario, but they are still carriers, so they can still end up spreading the infection. So they also need to follow all the possible precautionary measures and be on alert as to they don't develop any symptoms. And if at all, we can prevent any long-term complication. So medical attention would be very important the moment you test positive for the infection.
Great.
Yeah.
Thanks, Doctor. Before I go on to the next question, it's one for our attendees. There is a Q&A box that you'll find on your screen. For those of you who are familiar with Zoom, feel free to ask any questions along the way. Of course, we will have a Q&A section at the end of the talk as well. But if you have any questions while we're answering questions, please feel free to ask them as well. So, Doctor, you mentioned at the outset that, of course, we know that COVID tends to affect the lungs. Can you elaborate a little bit about that? What's the impact that COVID has on?
Yes. So basically, as I said, these are the basic symptoms which people can suffer from. But obviously, if these symptoms are ignored or if the treatment is not taken on time, the infection can spread onto your lungs as well, because mainly it's a respiratory illness. And the moment it spreads onto your lungs, it's going to affect your capacity to breathe. So basically, people can start experiencing difficulty in breathing because the virus is going to affect the small cells of your lung tissue in which the air enters, which are normally called as alveoli. So as these air sacs or these air bags, they get on getting damaged, the overall lung tissue gets affected, and that is what becomes the cause of you feeling breathless. So basically, it's going to affect the total amount of air entry into your lungs and eventually affect the amount of oxygen in your overall system, which can actually have a very long lasting effect, basically, because even after taking the correct treatment for the infection and also getting your lungs treated, but the damage which can affect your lungs, that can stay for a long time. And people can eventually suffer from long lasting chronic lung disorders.
And that was actually my next question, really, which is that, can you talk a little bit more about the long-lasting impacts? Because people tend to think that after they've come COVID negative, then they're okay and they can, resume their normal activity the way they used to. But of course, going by what you're telling us, and we're seeing more and more, cases and episodes, unfortunately, of people who, get back to normal levels of exertion, but really, they haven't fully recovered.
Correct. So basically, as I said, it can affect the lungs, but a lot of these new studies and new data which is coming out after studying all the people who have got affected and also studying them for a long term, it has been seen that the COVID-19 does not really stay only as a respiratory disorder or as a lung disorder. It has actually affected all the other organs as well. So many people have suffered from problems related to the heart, where have suffered a sudden heart attack, okay, even after a month after testing negative. And that is a correlation that they would develop, that it has occurred mainly as a consequence to the COVID infection, which was mainly a delayed effect. So after studying such cases, they found that the COVID infection has actually led to some type of an infection on the heart wall, which is also a muscle, or it leads to basically a scarring on the heart tissue and the lung tissue, which can happen and which can really lead to a symptom in a delayed way. So people don't realize that they have become absolutely fine or negative, but they are still not capable of getting back absolutely to that normal level of activity that they would think they should do. And without getting some proper guidance, they would jump to just doing a very vigorous thing. And that's where the event can happen in a very sad way. Plus, it can affect your brain. So there are cases where people have suffered a stroke, people have suffered convulsions or seizures, what we call is that fit. Okay, and also some people have developed mental disorders like depression and anxiety. Severe muscle pain has been a very common effect, especially after a month or 2 months. So there was recently a study which was done on Chennai-based doctors who returned to work after a month after testing negative, and they were constantly complaining of chronic pain in the whole body. And that is what can happen, So even after testing negative, no matter how healthy you might have become, but it can have a delayed effect. Okay. And mental health, as we discussed, it can get affected because there's a lot of mental stress around the overall situation which people suffer from. And that's where people need to be careful in terms of how they get back to their normal life, how soon they can really start putting their body under that same stress that they were doing prior to getting infected. And that's where the rehab plays a very important part. And this is something which is applicable not only for people who are really having severe symptoms, but also for young people who don't have any major symptoms or don't have any comorbid problems, because normally we would think of all these problems only for elderly people, but that's not the case. There have been incidents where even young people have suffered serious heart related issues, so people need to be careful once they have infected, and even after turning negative, they need some guidance, they need some supervision to really get back to their normal physically active life.
Right. That's very helpful. And we have some great questions coming in from Gaurav and Vineet. I'm going to take these questions in a bit because they're very relevant to what you're just telling us, Doctor. Obviously, what we do know now is there are longer term impacts, and you mentioned something along the lines of rehabilitation that can be done. Can you elaborate a little bit more? What can we do to minimize long term impact of COVID?
So basically, one is obviously the moment you get affected or you have tested for COVID, that's actually the time when you need to start onto the rehab program as well. Now, whether you are in a home quarantine or whether you are in a hospital because of the severity of the illness, the rehab should start immediately. So, what do you actually mean by rehabilitation? Basically, rehabilitation is a branch of medicine which involves basically restoring your health back to a normalcy, and how we can improve your physical condition by three aspects. One is by training your body, by giving you certain therapeutic measures, and all this to happen under strict supervision. When these three things are happening together, obviously your recovery becomes much more better. The person will confidently now know what he's supposed to do, how much he's supposed to do, and how he's supposed to progress, as opposed to you end up doing things by yourself where you really don't know what is happening inside, and eventually can lead to a big disaster. So rehabilitation has its importance right from day one, the moment you are getting infected, until you are completely recovered and back to a normal life. Okay.
Sure.
So as we say, this can act at different stages. Okay. And which I just mentioned, it can be right from day one, which we call it as the acute phase, or you are recovering, or even after coming back home and after testing negative. It ideally should continue for some time till the rehab specialist feels that you have now completely recovered and you can get back to your normal life.
Great. And of course, as we know that the rehabilitation protocol, ideally speaking, can start even if you're not infected.
Exactly. So basically, it can have its own preventive effect as well. Yes. So people who have not tested positive also, although we use the word rehabilitation, but rehabilitation can also be preventive measures. Okay, rehab did not always mean only after getting affected by some chronic disease. It can also play its role in a prevention of a disease. So the more you can improve yourself, both physically and mentally, under some supervision, by taking the rehab specialist help to get your risk factors under control, you are preventing yourself from suffering from any chronic disease in the long term. Okay, so it is definitely going to be helpful both in terms of prevention as well as recovery and getting back to a normal life.
And more specifically for COVID, I know rehabilitation is relevant for all chronic diseases, but specifically for COVID, who needs it? How long do they need it for? Who should be delivering it?
So who should be delivering it? For sure, it has to be delivered by people who are specialists in the field. So we call them as rehab specialists. In simple terms, people would also relate rehab specialists to physiotherapists. But when we are dealing with a certain illness, we need that specialist to be having good enough knowledge with regards to that illness as well. So we have rehab specialists who can be a combination of a physician as well as someone who has specialized in rehabilitation of chronic diseases. All right. So we as a first doctor team, we run cardiac rehab program, cancer rehab program. Now we have started with this COVID-19 rehab program, whereby we specialize in all these specific chronic diseases, so that all the care that you are getting for that particular illness, you are getting it under one single roof. Okay, whether it is regarding your medications or it is regarding any specific complication that's happening and recovering from that particular complication, unless that specialist has a comprehensive knowledge about that particular disease, you won't get a complete care. And that's what is the role of a rehab specialist, that because of his expertise and because of his all-round knowledge in that field, he can definitely help you to recover much more faster. So in terms of the plan, okay, in terms of the rehab benefits that we are talking about, why it is required? Because when you are suffering from COVID-19, now to specifically talk about COVID-19, as a delayed effect or even as a chronic long-term effect of that COVID-19, people can have an impaired lung function, people can develop muscle weaknesses, joint stiffness. There's something called as a post-viral fatigue syndrome, okay, which basically means because of that illness, they develop this chronic fatigue syndrome. Okay, they might be absolutely fine, no symptoms, but they still feel very tired throughout the day. And I have been rehabilitating a couple of patients recently who have got infected almost 3 months back, and they are still not up to the mark. They are still struggling to walk, without support. They are struggling to maintain their balance. So this fatigue can really last for a very, very long time. And that can be because of various factors. It can be the effect of the illness, because of the immobilization due to the illness. So eventually you need that proper guidance and supervision to get back, and that's where rehab would be very specific for the COVID illness. Because as we said, eventually all your organs are getting affected. So you would never realize which part is getting affected. And because we will be constantly monitoring your progress, we will know how your parameters are staying and accordingly help you.
Great. And of course, again, coming back to the lung function, we know a big part of the rehab protocol for COVID is pulmonary rehab, which is,
Yes.
rehab for the lungs.
Correct.
Can you elaborate a little bit more about what that protocol or program entails?
Yes. So pulmonary rehab is basically, as the word says, pulmonary stands for lungs, and we want to basically rehabilitate your lungs which have got affected because of the COVID illness. So if you were to just look at what do you mean by pulmonary rehab, it's actually a part of your medical management. Whenever anyone suffers from any chronic lung disorder or any acute lung disorder, pulmonary rehab becomes a part of that entire treatment process. So just taking medications or only oxygen treatment for the lungs is not enough. You need to really work on your lungs, make your lungs improve on their overall breathing capacity. So basically, it's about how we can help you in terms of reducing the symptoms related to the lung function and also optimize the function of the lung, which basically we do with the help of these five components. So pulmonary rehab is basically something where we're going to first evaluate you medically, try to find out what is your current capacity with regards to your lung function or your breathing capacity. Depending on that evaluation result, we're going to plan or we're going to prescribe you a medical exercise program, which can be a combination of physical rehab exercises and breathing exercises, but all dependent on what your current capacity is. And while you're doing that, we are constantly monitoring you and supervising you as to how your lungs and or how your overall body is responding to those particular exercises. So we would have special monitoring techniques by which we would come to know how the different vital organs, which includes your heart as well, your lungs, and your overall muscle strength, how all these parameters respond to the exercise or the rehab program. Plus, a very specialized nutritional advice is required to help you recover from the illness. And obviously, because of the mental stress that you suffer from, we also try to incorporate a psychological support. A lot of counseling keeps on happening. We have these support groups for various chronic diseases where people can interact with each other and really build up each other's confidence, because eventually everyone has gone through that same illness, and by sharing each other's experiences, that's how you develop that confidence that if that person can do everything even after a problem, even I will be able to achieve that particular level of activity. So that psychological support also plays a very big role in making you confident of doing things. So this is what is a comprehensive plan, which we try to cover in that pulmonary rehab program. Although the word says pulmonary, but with the COVID situation, we end up doing even cardiac rehab and pulmonary rehab together because it can have an effect on your heart as well. So we are trying to incorporate all the things together.
So I guess the key point here is it's ideally speaking, anyone who's been through COVID should go through some form of a rehab protocol such as this, because the importance of being medically monitored is extremely important.
Absolutely.
On that note, I'm going to bring in the questions that we have from the attendees. So
Yeah.
Gaurav asks, people with bronchitis, asthma need to be extra cautious. What are the things within our control, like yoga, kara, etc., that needs to be done daily?
So definitely when you say people are suffering from bronchitis or asthma, these are actually a part of a syndrome called as chronic obstructive pulmonary syndrome, which is COPD. And these are all chronic lung conditions whereby, especially the bronchitis part, what you're saying is a chronic condition which probably is more like an irreversible thing where your lung tissue has got damage and you would have to be on a therapeutic plan on a long-term basis. So just taking those medications or those inhalers are not going to be helpful. You need to add it up with a proper rehab program whereby I can improve your lung capacity and more objectively, I can reduce your dependency on those inhalers. And that's what I guess everyone would want to. Eventually, we want to see how we can improve your quality of life. So people with bronchitis, asthma, they do have difficulties in doing so many of their day-to-day activities. And that actually really tells us about how much the quality of life has got affected. So if I can improve on those aspects, it's a great achievement for them in spite of having that chronic condition. So definitely people with asthma, people with COPD should definitely go through a supervised rehab program to help improve their overall lung capacity and their overall quality of life.
I hope that answers your question, Gaurav. Although he sent another message shortly after saying that he tested negative on the 7th of October. But nowadays, whenever he goes up and down the stairs or he walks past on the terrace, he feels breathlessness for 1 or 2 minutes.
Correct.
He's still taking steam twice a day and he's checking his oxygen levels regularly on an oximeter. He's joined his office back at the SBI back on the 14th of October. And he's asking, what should he do? How to fight that mental trauma? What precautions do I need to take in the office? And I guess, really, Doc, before you answer, what you just said to us is, in an ideal situation, he should do a rehab protocol, really a monitored medical protocol to help him understand where he is and to overcome the trauma that he's talking about.
Correct. Absolutely. So basically, as he's himself mentioning about the long-term side effects that he's still having, okay, with regards to feeling breathlessness by climbing floors, that itself is showing that just having a normal oxygen in your pulse oximeter is not an enough indicator to say that you are back to normal. Okay, that simply indicates that the oxygen in your blood is at normal levels, but still does not mean that your lung capacity is back to normal or your what we call it as your effort tolerance is back to normal. So by doing a rehab program, my objective would be to improve your physical capacity, to improve your effort tolerance, to improve your overall lung and breathing capacity, such that we can reduce this feeling of breathlessness, make you capable of even climbing 4 floors without feeling breathless, and make you physically capable of doing anything that you desire. Okay, so definitely from your perspective, with your specific complaint, we do strongly recommend that you should be doing some sort of a supervised rehab program. It might be for a short time. I mean, how much time would it take for you to get back to normal can be very much unanswerable because every person's feeling and capacity would be different. But definitely within a certain period of time, you should be back to what you were prior to the illness. That is for sure. But it just for that, you need the correct guidance as to how to progress. Today, probably you are trying to do a little more than what you are capable of, and that is why you are feeling that tiredness. But we will be able to measure that capacity of yours and then accordingly make you climb up those particular steps such that you are able to get back to a normal.
Right. I think one thing that we see, and it's commendable, people obviously want to get back to their normal routines. If people were exercising vigorously prior to COVID, they want to get back to it.
Exactly.
But people also want to be self-independent. They don't really want to depend on anyone as much as possible, right? So I guess a lot of the questions here are along those lines. What can they do on their own really to get better? I think the danger and you spoke about this at the beginning, is that, we all have now heard of several cases. There was this person in the news just last week in Delhi, 45-year-old gentleman, very successful businessman who had COVID a few months ago, went for a run, and he had a cardiac arrest and collapsed and passed away, unfortunately. Tragic story. And we're hearing more and more such stories, people who, were fit and very healthy prior to COVID, but they really, pushed it a little too far. And there is this tendency to think that I'm okay and let me get back to normal. And really, this is why we're doing this webinar, really, just to emphasize that it is so important to get the right parameters checked. And the only answer to say, look, when can I get back to normal, whatever that normal might be, is a function of where your parameters are, right? So if your parameters are showing that you're okay, then it's okay to revert to a normal lifestyle. But till then, you should be, being more measured and cautious.
But many of the times, even these parameters can be misguiding. As I said, just measuring your oxygen through the pulse oximeter and seeing that my SpO2 is normal does not really mean that you are absolutely fine now. Okay, it all still depends on what is happening inside your body while you're doing an activity. So as you said, a person which you mentioned about in the news a month back, he recovered from COVID a month back and he suffered a cardiac arrest while running. It's quite possible that probably he tried to do things in a much vigorous intensity much too soon, and purely on with the hindsight that he used to do that earlier, and now because he's turned COVID negative, I think there's no problem for me to get back to that running what I was doing before. But he probably doesn't know or didn't realize that the COVID could have got some effect on his heart. As I said, it can affect heart, it can lead to some scarring on the heart muscle, and that is what can lead to those sudden events. And that's where that monitoring would be important. So it's not that we don't want to get back to running. It's just that you should know when is that right time when you can really revert back to that intensity of activity which you were doing prior to the infection. So it's just a matter of time whereby you need to be trained, you need to be supervised, and you need to be hand-holded and taken to that level of intensity, after which you can just maintain yourself. Okay, then it's just about how you keep on doing those things correctly. But
Right.
to reach that level, sometimes some people would take a longer time, some might take a little shorter time, but it's good to have that guidance. That is what is the important factor.
Right. I'm going to take a question here from Vineet Kumar. He asks, what precautions do you need to take care after discharge from post-COVID-19 for people who have BP, diabetes, and asthma? What should they do to get fully recovered?
So again, the answer is the same. We should do a rehab program which is supervised, but because you are having hypertension or you said you are having diabetes, it's very important to monitor these parameters while you're recovering from the illness. So even though you might have turned negative, you might have been discharged from the hospital, but any illness, okay, no matter what type of illness we suffer from, it does affect our vital parameters. So you would notice many a times that your sugars will fluctuate, your blood pressure will fluctuate, and that's where the monitoring of these parameters would be equally important. So as a part of the rehab program, what we normally do is to monitor all these vital parameters which can get affected, So prior to doing any activity, or probably give you a guideline when are you supposed to measure these parameters. So the more you keep on monitoring these parameters in the first few days or weeks post the illness, your recovery can be much more better, rather than just ignoring them and trying to do things by yourself, all right, and trying to push yourself beyond certain limits. These parameters can just go haywire and create a complication. I myself know about a case who was COVID positive, and things can happen. He was a diabetic also, and somehow he just ended up taking a medication. Again, as you said, there are lots of these WhatsApp messages. Some time back, there was a full-blown treatment which was published and WhatsApped. Okay, this is the treatment which people can take. No treatment can be a generalized treatment or common treatment for anyone. Okay, so randomly people, because positive, he started the treatment, he was diabetic, and because of a certain drug effect, his sugars shot up to 500. He had to immediately get hospitalized. Okay, he was under simple home quarantine with hardly any symptoms, was a diabetic, but without any advice, without any supervision, took the tablets, sugar shot up. So that is something which is very wrong. And that's where any type of advice, any type of supervision would help you. Okay, you can take that advice from anyone, can be it your physician or your known doctor, whatever it is. But you take that advice and understand from them how should you get back to a normal life rather than just trying to push yourself the moment you become negative.
Although it is important, as you mentioned earlier, that it's important that you take that advice from somebody who is qualified to give it. Unfortunately, in these days, everybody is a doctor, and therefore everyone gives advice. Whether it's whether it's yoga or it's correct nutritional advice, these are all wonderful things, and we should all be practicing them. But the point is not whether yoga is good or bad. The point is the person who's giving it to you. It can be well-intentioned advice, but do they have the medical understanding of the condition that you have? Are they really tracking and measuring the parameters?
Correct.
That's the key. They mean well, of course, but the point is, this is a medical problem and it needs a medical solution. That's the key.
Absolutely. So there are so many programs that are advertised nowadays. Okay, it's a good thing whereby the awareness is increasing, whereby you should do things which are helpful for the body, but at the same time, the person giving that particular advice should also be a qualified person. All right, where he really understands that illness properly and he knows exactly what will be the effect of the advice that you are giving. Okay, so even a simple, I mean, it can be anything. I mean, it can be a simple exercise, it can be a simple nutritional advice, but whether that particular advice will be helpful to that person or not, you will know only if you are having a comprehensive knowledge about that particular chronic disease. So you need advice from specialists, you need advice from professionals, and then accordingly you can follow these advices.
Vineet also asked a question I think which you partly answered already, which is to say, for how long should a COVID patient keep watch after recovering?
So keep a watch is something till I would say you are able to get back to that optimal health level. Now that optimal health definition can be very difficult because every person can have a different mindset, can have a different goal to achieve. All right. So from certain people's point of view, it would be okay, मेरा oxygen normal है, मेरा pulse normal है, BP normal है, so I'm fine. But there might be people who might be having other goals also. So from a person to person, the goals can vary. As the other person said, he has to climb stairs and gets breathless. So for him, that goal would be that when would I be able to climb 4 floors without feeling out of bed? All right. So how long should you take care is something which is absolute not completely answerable, but definitely for the first 2-3 weeks for sure. After you have turned negative, you need to be careful and you would need some guidance and supervision, by which time you should be able to reach a very decent level of optimal health, which can again vary depending on how much was the severity during your actual infection stage. So just because I've turned negative today does not mean in next 2 weeks I would be fine. What if I've already spent 3 weeks in the hospital during the infection? Okay, so there are many case studies. Probably I have a slide later on where a doctor was admitted and he was in the hospital for 3 weeks, and after getting discharged, he could barely stand. Okay, he needed support to get out of the bed, and a young doctor around 55 years of age. Okay, so no matter how fit you were, the illness can have a different type of an effect on each person. Okay, so now how long will he take to recover back? We don't know. It depends on how his body responds to the rehab program. But he's going through the rehab program. He's suffering from hallucination. He needs a speech therapist to talk. Okay, so many complications have developed in him. And just a simple same COVID illness.
Right.
Okay, so basically from every person to person, it can vary.
We're going to take a few more questions, and I know that there's several requests from attendees for some kind of general advice on exercises and so on. So I'm going to let you come to that very quickly. I'd love for our attendees to see some demonstration of really what they can do on their own as well. Of course, with the caveat that you told us already, which is, ideally there should be some supervision, but still
correct.
Worse stuff.
You should not say that this is Dr. Kiran who told us that we all can do this.
But even so, I think it'll be good for you to show us some things anyway. But let me take a couple more questions. And of course, to all our participants, if you have any more questions, we have another sort of 15 minutes to go. So please send them through now. We have a question from Haren Gandhi asking, I guess it's a more general question. When should we do a COVID test? And is it better to go for a COVID test or a CT scan?
See, again, when should we do a COVID test? Some people can do it on a preventive measure also. Someone who is really traveling in crowded places and going to public gatherings and really wants to find out for himself, has he got infected or not? Because as I said, people can be asymptomatic also and still be a carrier. So if you just want to find that out, you can do a test anytime. But obviously, the moment you find any symptom of the generalized symptoms which I spoke of, which is fever, cough, or breathlessness, body ache, first of all, you need to consult your doctor. I don't say that just because of the symptom, you can directly go for a test. It's always important that you consult your doctor and take his advice before you decide doing the test. And what test to do? Obviously, there are these two tests which you spoke about. Should I do the swab test, which is the RT-PCR test, or should I do the CT scan? Now, both of them have been recently followed by doctors and the medical fraternity as quite confirmatory tests, where we want to see the impact of that infection on your lung also. So a CT scan of the chest tells me whether your lungs have got affected or not, and which we diagnose basically on a certain type of an appearance which is seen on the lungs, which is very specific to the COVID infection. And that's how we come to a conclusion that you have suffered from the COVID. But it's quite possible that it's not really affected your lungs and it's still only in the upper respiratory tract, which might not then come onto your lungs. So then the swab test would be able to detect whether you're still positive or not. So definitely I would say as the first test to do, it was better to do a swab test, which is the RT-PCR test, which can detect people with mild symptoms also. And obviously, if I want to see whether my lungs have got affected or not, I can think of doing the CT scan of the chest.
Okay, I'm going to have to go a little quicker, Doc, because there are quite a few questions coming through and we don't have that much time.
Okay.
But let me take this one from Anjali. She's asked, hi, doctor, could you please elaborate a little bit more on muscle weakness and fatigue and what sort of exercises could help us improve on that?
Yes.
Also, how much would taking steam help us in dealing not only after testing positive, but also from a preventive measure point of view?
So basically, we want to exercise to improve on all the factors which have got affected because of the COVID. And one of the factor which gets affected is your muscle strength. So people can develop muscle weakness, people can have body aches, and definitely exercise would be something which will help you to improve on those factors. Now, frankly speaking, someone who gets infected and is recovering from the infection uh, can definitely start with very basic exercises, which would mean doing simple body movements at home. Okay. I mean, it can be a very simple functional activity where you're just doing marching on the spot, you're doing simple hand movement exercises, you're doing some exercises lying down in the bed. Primarily because when you get infected, you're feeling very weak, you're having fever. So you become bedridden for quite a long time. Even people who are under home quarantine, whom we are rehabilitating nowadays, we come to know that in home quarantine they are just doing nothing in that room, probably just watching some web series, but not really engaging themselves in physical activity. So really, no matter how little it is, but you need to engage yourself in doing some type of a basic physical activity so that you are keeping your mobility going. All right. So as I said, simple hand movements, leg movements, and simple body movements in lying down, standing position. Again, depending on your effort tolerance. What I'm saying now is a very generalized thing. It will vary from person to person. For some people, even getting up from that bed would be very difficult. And some people would be able to do 15 sit-ups also very easy. All right. But you need to keep on doing some things because the more you stay immobile, that's where the delayed effects will be more prominent after 2 weeks and 3 weeks. So people should not really think that I'm still positive, so I should wait for me to get negative and then only I'll think of starting. No, you don't have to really wait. The moment you are infected, even in a home quarantine or in the hospital also, we know that physiotherapists will go and make that person do some mobility exercises. So basic mobility exercises, whatever, even your basic school-based PT exercises, if you remember, you can start. Okay. But then how to progress from there on is something where you would need the correct guidance. Okay. So that is what you can do from the exercise point of view. With regards to steam inhalation, frankly speaking, every physician is advising people to take steam inhalation. Even I do advise all my COVID patients to take steam. But as such, really speaking, there is no such data which is available to say that steam inhalation will help you recover from the illness faster. Okay, it's a good way to really soothe your upper respiratory tract, but will it remove the virus from your system or not is still an unanswerable thing. But at the same time, it's not a harmful thing. So you can still go on taking it, but don't get obsessed with it. There are people who take steam 5-6 times in a day, and somehow it will be so much of steam that it can actually lead to a lot of problems in your upper tract. All right. So take it in that like say 1 to 2 times in a day, 5 to 10 minutes is good enough. But again, at the same time, don't expect magical results from it. Don't be in a blind spot that because I'm taking steam inhalation, I will not get the COVID infection. So many are taking it as a preventive basis also. All right. But whether it will help you to prevent there is no such proven thing. Only thing which can help you to prevent are those 3 W's. Okay. So that is my take on that.
Great. I'm pretty sure we're going to run over time here because there's some really great questions coming through. And I'd love for us to be able to answer all of them. So I'm going to kind of take the liberty of saying we'll extend it by an extra 10 minutes post 6, if that's okay with you, Aditya.
Go for it, please.
But, like I said, I also want you to kind of demonstrate some breathing exercises.
Yeah.
I'm going to move to the next question. I'm also going to say to all the participants that, we're very happy to, have individual consultations, personalized consultations for anyone who's registered for this webinar today, so that we can give you one-on-one advice and recommend what protocols you might need. At the end of this presentation, we'll share, the website as well as the email address and the phone number. So feel free to reach out to us. We're not charging for this at all, but feel free to reach out to us and we'll be happy to kind of answer your questions on a one-to-one as well. But moving on to the next question, for how long do we need to take medicines in case of a lung infection?
Oh, that is something which cannot be answered in a generalized way. Would depend on everyone's lung infection, how much it is affected, and so that would be purely on a personalized basis. We cannot really generalize that duration for any person.
Okay. How do you differentiate? This is a question from Mandalika Subhadra. How do you differentiate between breathlessness due to COVID-19 from that caused by GERD or asthma, etc.?
Now each of these are very different illnesses. First of all, obviously, just purely from the breathlessness point of view, breathlessness is basically a symptom, which basically indicates a difficulty in breathing. Now, just the difficulty in breathing cannot really tell us what illness you might be suffering from. We need to really investigate it further to really find out what would be the underlying condition. Even a heart condition can give you difficulty in breathing. So really it would need a proper investigation from the physician's point of view to find out the underlying problem. With the current scenario, obviously anyone experiencing a slight difficulty in breath, the first doubt that would come to the physician's mind also that it can be underlying COVID infection. And because you don't have any past history of breathlessness, and this is a sudden development, obviously we can think of getting tested for COVID-19. All right. But there are other problems whereby people would have histories of breathlessness in the past also. And that's how we can really clinically correlate to find out, first of all, would it be COVID related or would it be related to any of the past illnesses which you're already suffering from? And then probably think of other further investigation to come to a conclusion.
Thank you. A question from Gaurav asking, he's from Ajmer, and he's saying, how can I get this rehab and monitoring? So
basically, as we share our details at the end of the program, you can just connect with us and we'll discuss how we go about it.
And just
plan a schedule for you.
We do a lot of these things virtually these days. It's the nature of doing in COVID times. Of course, a physical treatment is always preferable if possible, but in these days, a virtual treatment also is very effective.
Yes.
And we can run a virtual program for anyone across the country.
So this is just what we do, virtually. So we've been doing teleconsultations. We'll be doing the virtual COVID rehab, and everything is very strictly monitored. It's all under supervision. All the parameters are monitored. Some places we would need the clients to buy a few devices, but that's okay as long as you're getting monitored and you're getting the correct advice with regards to how to progress. People are very happy to follow the advice and would recover in a much, much better way. So we have been doing it virtually for sure. So anyone from anywhere can connect with us and we can definitely put you onto a properly supervised rehab plan for your COVID-19.
Right. And this need not be, extremely long. I mean, we typically start with a much shorter protocol just to help people get started and get the right advice, and then they can.
Yes, absolutely. So we start with as small as 6 sessions, 12 sessions. Each session does not really go beyond 30 to 40 minutes. It's very basic. The main crux of the program is the supervision. Okay, as opposed to doing the thing, it is all about supervision and getting that correct guidance. And then depending on how you are progressing, depending on the severity of the illness that you have suffered from, we take it forward from there, whether you need to do it for a little longer or not.
Right. Okay. There's a question from an anonymous attendee saying, what are the changes that occur in blood and lungs during the COVID infection?
Sorry, say that again, Anuj.
What are the changes that occur in the blood and lungs during COVID?
So basically, we do run a few investigations to find out if you are suffering from COVID or the effects of COVID on your certain parameters. So with regards to lung, as we all know, it affects the lung tissue and will definitely affect your overall breathing capacity or lung capacity. So your lung function parameters can get affected. Obviously, in the current scenario, to really find out your lung function, we need to do a proper pulmonary function test to measure your different breathing volumes. But there can be very basic tests also which can be done on a virtual basis when we do the rehab program, where we try to find out your breathing capacity. Okay, so there are these lung exercises which are available where we know how much is your suction capacity, how much is your inhaling capacity. Then there are these breath holding tests which we can make you do and find out how long can you hold a breath. So depending on that also we can estimate what is your current lung capacity. Plus there are certain blood parameters which we test for. Now these are something just to know how the infection is progressing. So a simple CBC also, the blood counts, the white blood cell counts, they tell us how the infection is progressing or improving. There are this CRP, which is a C-reactive protein, which is basically an inflammatory marker. The changes in the levels of that inflammatory marker will tell us whether your infection is increasing in severity or is improving. So wide variety of these markers are there, and the doctor will decide which markers should I really get tested for. We don't really test each and every marker for every person. It all depends on how clinically you are representing, and depending on that, I would ask for a detailed investigation. Otherwise, simply just a one swab test to test you positive, and I can still treat you without doing any other blood parameters.
Got it. Okay, a question from Praveen Kumar, and there are quite a few of these very specific questions, Doctor. I'm going to take you through them. Praveen asks, my father's still in hospital. It's his 22nd day.
Oh.
Sorry to hear this, Praveen. From the day 14th, he got remdesivir injections. He's got oxygen support. Now his oxygen saturation is fluctuating. At 5 liters oxygen, he's maintaining 97 oxygen saturation. He has hypertension. I'd like to know how many days would it take for complete recovery? And is it okay with fluctuating oxygen saturation? Sometimes it comes down to 87.
See, frankly speaking, how many days will it take? I would not be able to really answer that very clearly, because it's again a very individual response, and how his body is responding to the treatment, we can't really predict, but these things can just immediately improve also. You suddenly might not realize, and after 2 days you might see that now his oxygen requirement has reduced to 2 liters or 3 liters. So frankly speaking, a very difficult question to answer, to really give you an exact duration when he would recover. Although he's on the right treatment where he is given that oxygen and is given the remdesivir, and we just have to wait and watch when his lungs can cope up with a reduced oxygen support, and how we can sustain that oxygen saturation without that oxygen support would be the time when we would know that he has completely recovered.
And I think it's also important to point out that, while patients are in hospital, the focus of the medical team there is very much to use medication and sort of generic treatment at that point in time to get the infection, back. So I don't know if that's an appropriate time for us to engage with an inpatient on a rehabilitation protocol at that stage.
I'm not sure whether the hospital would allow us, but I'm pretty sure, or I hope that the hospital would be having some sort of a rehab program or a supervised exercise program, which their team of physios would be doing for your father. So, and that would be definitely helpful in improving his oxygen capacity, and that is what is going to be in addition to the treatment. So only the medications definitely will not be enough. He would be requiring a supportive rehabilitative care in the hospital as well, and we hope that's happening, and difficult for us to really engage at this point of time.
An anonymous attendee asking, is fibrosis in COVID permanent?
Not really, frankly speaking. Again, it would all depend on how severely the lungs have got affected at that point of time when the infection was very active, So it all depends on how quickly you really took the treatment and how quickly the body or the lungs responded to the treatment and did not leave a long-lasting effect. So again, it can be a completely reversible thing whereby your lungs will become absolutely normal. But in some cases, people can develop a long-term COPD as well. So it all depends on how the lungs. It's not like a generalized rule that everyone will suffer from that. All right, it would vary from case to case depending on the severity.
A question here from, again, there's no name, it just says lung scare. Any common exercise or medication or food precaution that you'd recommend that will help in the recovery of lung capacity or fatigue?
So exercise would be, as you asked, and probably we can demonstrate it now, is something where we need to do physical activity, as I mentioned some time back, basic mobility exercises, which you need to keep on doing even while you are recovering from the illness. And those can be very simple hand and leg movement exercises, which we eventually make you progress to a higher intense activities, depending on how your parameters are responding. But along with that, you can think of doing some basic breathing exercises, whereby so these are, I think I just mentioned some time back. So basically we can use a lung exerciser. As you can see in this picture over here, this person is using this lung exerciser machine, which is basically helping him to exercise his lungs by breathing in deeply. So I have got one more option over here. So I have got this lung exerciser. Okay, this is another variety of the same type. All right, whereby I just have to simply, so you can see there's a ball inside, and these are available at the chemist shop very readily, okay, easily. So you can just buy this lung exerciser, and there are different resistance levels which are there on this, which will basically make my breathing more difficult. So I need to really apply more force to suck in the air and keep that ball hanging in the air for a longer period of time. All right, so if I just suck in like this, so now it all depends on my lung capacity. How long can I keep that ball hanging in? So how forcefully can I breathe in? And if I keep on repeating this multiple times in the day, so we say normally at each time you can do roughly 5 to 10 times and do that 2 to 3 times in a day. This will automatically become a good lung exercise, where you are making your lungs work to breathe in more deeply, to force that ball to stay up in the air. All right. And the similar is that other device which you can see in the picture. So that's one lung exercise which we can do. There are other breathing exercises which we can think of doing. One is called as the thoracic breathing, whereby I can simply put my hands on the chest and I try to breathe in deeply. And when I breathe in, I should observe my chest bulging outwards. Okay, so basically we are trying to focus on the upper part of the lungs. And your placing of the hand helps you to identify how much of your lungs are moving in and out. So something I can breathe out through my mouth. So this is what we call it as a thoracic breathing, which will help to exercise your lungs. Okay, the upper part of the lungs. Now, if I want to exercise the lower part of the lungs, what we call it as the diaphragmatic breathing. This diaphragm is nothing but a respiratory muscle. So I can simply place my hand on the side of the chest, just at the junction of the chest and the abdomen. And as I breathe in deeply, I should observe my hands widening outwards. So what I'm trying to do is to expand my thoracic cage outwards. Again, increasing, helping my lungs to expand better and get in more air. Okay, so you keep your hands here. So this is what we call it as the diaphragmatic breathing. And the third breathing we can do is an abdominal breathing, where you try to place your hands on the abdomen. So I hope you can see me, Anuj. So I'm just placing my hands on the abdomen. And now as I breathe in, I should expect my abdomen to bulge outwards. So now we are focusing on the abdominal part. Now, these are very simple, basic breathing exercises, okay? Now, which something everyone can do to improve their lung function, especially when you have got infected and you are positive and are recovering. So these breathing exercises, say 10 times each time and probably 2 to 3 times in a day, will be a good addition to your medications, apart from the physical activity that you do. Okay, so I think these are basic things what you can keep on doing while you are at home.
Great. I'm just keeping an eye on the time. It's 6:05. But I'm going to keep going for a little while. So I think the good thing is you've shared the breathing exercises, which is helpful. If I can just request, Doctor, if you can just share the contact details slide, so that people who want to exit, they can at least take down the details. Sure. We'll keep going with the questions for those who still have them for a few more minutes.
Yes.
There's another question from Vineet. He says, I've got discharged last 8th October. I'm following this week with the doctor, tomorrow with CBC, CRP, and an X-ray. Hence, I need to keep in touch with the doctor for the next 3 months. I'm not sure if that's a question, but I guess he's just asking you to confirm.
It all depends on how your parameters would come in your blood test. Basically you have tested negative, but it also need to be seen that how your body is responding. Are you having any of those long-term effects? And basically, if you join the rehab program, obviously we would be able to monitor your parameters and help you with the progress. Okay. Now, whether the follow-up is required with your doctor for 3 months or not, we are not sure. We cannot really comment at this point of time, but it would depend on the parameters. So we will be, I mean, you can get in touch with us. We can have a consultation and then probably decide the future plan of action, whatever is required.
Anubha Ved asks, would you recommend exercising, breathing, and light weight training for people with a sedentary lifestyle or people who are on a wheelchair, even though they may be asymptomatic?
Absolutely. Yes, definitely. Exercise is medicine. You need to understand that, okay? And it has to be done in sync with your medications that you take, all right? You cannot replace exercise by anything. It will be definitely a supplement to your medicines. And it will improve the effectiveness of your medicines also. And many of the times the medicines are only to control the parameters. They are not to improve your health. So if I'm looking at getting back to optimal health, I would frankly speaking, say that exercise is the only answer to it. No matter whether you're on a wheelchair or you are having any other type of a chronic disorder, the worst of health can improve purely by supervised exercise.
And again, I'm just going to add that as a caveat for, I've said it many times, but the word supervised is very, very important here, especially for people who have advanced conditions. I think exercise is the best way to get recovered, but honestly, it's so important to do it in a supervised environment by a qualified practitioner. So I just want to re-emphasize that piece. So yes, exercise is the answer, but make sure it's getting monitored by someone who's qualified to do so.
Yes.
Gaurav asks, should I go in for an HRCT thorax after testing negative?
Not really, not required.
Okay. How do we estimate the timeline? Do we count from the day of being tested positive? Does the oxygen saturation fluctuate in the initial days or later?
No, it would all depend on when your lungs are getting affected. So frankly speaking, people can start with very mild symptoms also and can just stay with mild symptoms all throughout the infective period, whereas some people can immediately progress onto a lung-related complication in 2-3 days also. Okay, so it's all about being aware of the symptoms, seeking medical attention, not ignoring those symptoms, and get treated fast. Okay, that is how it is. But we don't have any fixed trend as to when your oxygen will start dropping down, or if it already did not drop down for 7 days, now I can be carefree. It's not that. You need to be under supervision, or you need that guidance from your physician as to what all parameters you need to keep on checking till the time you completely recover.
Next question is, does a blood clot occur internally secondary to COVID?
So there have been instances where COVID also has led to blood clotting, and people have suffered from thrombosis related complications. And that's where certain drugs are also injected. And these can be delayed complications. They are not something which will happen in the first 2-3 days or 4-5 days, are delayed. But yes, clotting has been found to be one of the complications. Will not really happen to each and every person. Okay, but that's again a complication which can develop apart from the brain problem or heart related problem or lung related problem.
Okay. Next question is, due to a fear of COVID, I am more sedentary and now I have back pain. Because I feel I'm just overall weaker. Please advise if improving my back pain can help in lung function. If I may, Doc, let me take the first shot at this.
Yes.
Aditya mentioned at the outset, apart from the first doctor, we also run an organization called QI Spine. And what we do there is really help patients who have back and neck pain. And what we have seen, of course, in COVID times is the incidence of back and neck pain has gone up dramatically because everyone's at home. And this whole work from home environment has led people to be sedentary. And of course, people are infected by COVID even more so. So yes, taking care of your back and neck is extremely important. And there is a way to do that again, virtually and online. Happy to share those details separately as well with you. But the question that you have is, does it help in lung function?
Sorry, so question related to lung function is what?
Please advise if improving my back pain can help in lung function.
See, again, those are two very distinct and separate problems, frankly speaking. Whereas your difficulty in breathing or lung function or the back pain, yes, both can be correlated together to your sedentary lifestyle, and definitely improving on your sedentary lifestyle by getting back to physical activity will surely help you to improve both your lung function as well and the back pain as well. But improving my back pain will improve my lung. We cannot really correlate that way. But trying to improve both of them by doing regular physical activity or moving out of your sedentary lifestyle would definitely be a good thing.
Great. So, it's past 6:10 now. I'm going to, while there are more questions, but I'm going to kind of, maybe call it a close here. Like I said earlier, please do feel free to send in your questions. You have an email address, phone number on the slide. Please do contact us, and we'd be more than happy to answer any of your questions thereafter. Thank you, Doctor, for your time.
Thank you.
Anuj,
Anuj.
Dr. Kiran, thank you. Can't thank you enough for this. Thank you for taking the time and educating us. Thank you also for your offer to the attendees to do these one-on-one sessions. I'm sure a lot of people will benefit from it greatly. Thank you to all the participants and the attendees for joining in. This is the first of a series that we are kicking off on the overall rehab of patients, and I look forward to seeing you in future sessions as well. Thank you, Anuj. Thank you, Dr. Kiran, once again.
So,
Thank you, everyone. Thank you, everyone, for a patient listening.
So I was just saying that the quality of questions that we've seen in those webinars have been very, very high. So thank you for making this a very engaging session. Really appreciate those queries. And thank you again, Aditya, for having us on board. It's like I said, it's very, very proud of the work that you're doing, and all power and good luck to you always.
Thank you, Anuj.
Everyone stay healthy, stay safe.
Very well. Stay safe. Thank you.
Stay safe.